is Nicola Kierce. I'm the Director of Nursing at Boca Recovery Detox, as well as the Boca Recovery Center. I manage the detox level of care all the way down through the IOP level of care. So I ensure that all the patient's needs are met on a daily basis on a detox level of care. As well as in residential, I make sure that the doctor is seeing all the patients and that the patient's medications are appropriate and they're helping them, and also that the nurses are maintaining all of their responsibilities. At the detox level of care, our primary goal is to ensure that we maintain a safe and supportive environment for a person that's going through detoxification. We monitor their vitals daily as well as manage their medications. We have 24-hour nursing care at the detox, and they are seen by a doctor and nurse practitioner daily. We use a few different medications which would be on their taper. We use Subutex for someone that struggles with an opiate addiction. Someone that has an alcohol abuse problem or a benzodiazepine addiction, we would use Ativan or Valium. Necessarily. Some patients that are struggling with cocaine or amphetamines are there just for a stabilization, and we'll monitor them to make sure their moods are appropriate. Sometimes they have an imbalance with the moods when they're detoxing from an amphetamine, and we'll put them on comfort medications as well as a mood stabilizer. We use several different comfort medications. Some of the most common medications that we typically use in a detox level of care would be clonidine, which helps with tremors, sweats, high blood pressure, and muscle relaxers, which we use Robaxin and Baclofen to help with someone that has some bone pains. And then we also use Visceral, which will help with anxiety. It's certainly a possibility if someone is coming off of alcohol or Ativan, benzos, but if they're on a seizure prophylactic, they shouldn't have any concerns. Seizure medications that we typically use would be Keppra or Topamax. Those are our most common medications that we use. We are always using FDA-approved medications that are up and coming. Medications that wouldn't be prescribed would be anything of a stimulant nature for ADHD or ADD, as well as mind-altering medications that someone that's struggling with addiction could potentially develop a habit from. There's a number of patients that come through that are struggling with anxiety and depression, and at that time the doctor would assess the patient to see what kind of medications, psychotropic medications, would help the patient. So they will be tapered off of the detox medications. In addition to the detox medications, the comfort medications can be used for some time after the 10-day detoxification to help with the minimal post-acute withdrawal symptoms. As well as if they are put on a psychotropic medication, we would have them continue that medicine. We do not allow them to leave with any controlled substance. So a patient, after they complete detox, we would step them down to a residential level of care. It's still in the same building as a detox, which would still require 24-hour nursing, as well as seeing the doctor and nurse practitioner daily. They will then have more intense groups, and clinical is then more prevalent, but we still monitor them medically until they step down to a lower level of care. That definitely gives us an opportunity to work and monitor them closely to ensure that they're stabilizing on the meds. And with them being in residential care, they're still seeing the doctor, nurse practitioner daily, as well as the nursing staff. So if they're having any side effects that are unpleasant, or just to see the progress of the medication, we can also document that. Yes, so I monitor their medical needs all throughout every level of care, all the way until our inpatient IOP program. So they will come then to another location, but they're still seeing myself as well as our nurse practitioner and doctor.